We will be recording this presentation today. If folks don't want to be recorded, feel free to turn off your camera. As you are joining, feel free to introduce yourself in the chat. We'd love to know where you're coming from today, if you identify as a community health worker or an ally, so we can learn a little bit about each other. We're going to have a super great, really interactive presentation today. I'm really excited to get to share with you some of our membership benefits and also get to share the stage with our fantastic Workforce Development Committee, really spearheaded by our co-chairs Kim Jae and Ben Hummel. But first, let me introduce myself. My name is Aurora Grant Wingate. I have worked at the National Association of Community Health Workers, or NACHW, for 3 years now as their member and partner engagement manager. And I am going to start us off here today with just a welcome and sort of a stage setting as we break into this conversation. And again, as folks are joining, please feel free to throw your name and your state in the chat, whether you're a CHW or ally. But here is what we have planned for today. We're going to spend a couple minutes sort of in a welcome and introducing the topic, and then going to do a quick icebreaker, see who's in the room with us. Me and my colleague Tasha are going to spend just a couple minutes going over our current member benefits and also doing a Mentimeter question or a poll question about other membership benefits that you all might like to see. And then we get to turn it over to our committee to lead you through a little bit about who they are, what their goals are, and they also have some really great interactive things planned for you to learn a little bit about more on how they can best be of service and what you might be looking for from NACHW. And then everyone's favorite part, we get to do some breakout sessions where members of our committee are going to lead us through some discussions. And then we are going to take the last minutes to hear what folks shared in breakout rooms and sort of close us out and sort of plan for next steps. And our learning objectives for today are just to, learn a little bit about NACHW's current member platform and member benefits, talk a little bit about the great work being done, and that's about to be done by our Workforce Development Committee. And then also try to identify some priority topics and questions for community health worker allies, organizations, specifically related to workforce development. Thank you so much to the folks who are still hopping on. Welcome, welcome. Please feel free to throw your name, your state in the chat, and whether you are a CHW or an ally. Okay, so we have our first Mentimeter question for today. This is a new program we've been trying out to let folks have another way to interact during our webinars. So there's a couple ways to join Mentimeter. One of them, as you can see at the top, there is a short link, menti.com, where you can put in a code to join. There is a QR code at the bottom left corner of the screen. So if you go to your phone, turn on the camera and scan that, you can get to it that way. Or my colleague Tasha just posted in the chat the link. I'm glad folks are already hopping on, but basically what I wanted to try to do today is I know there are folks registered from across the country, so we wanted to give folks a chance to log on and put a pin on sort of where you're joining us from today. It looks like we already have folks joining us from Maine, let's see, Pennsylvania, Ohio. I'm coming to you folks from Boston, California, multiple folks from Hawaii, Oregon. Great. Let us know if you're having any trouble or questions in the chat. Ooh, fantastic. We're getting a good spread, especially over the Northeast. But it looks like we have just about someone from every sort of HRSA region. Looks like we have someone from Colorado. That's great. Ooh, a couple folks from the same areas. Ooh, we still have some coming in from Texas, some different places in Texas. Love to see that. Texas is where we have some of our highest amounts of members. Let's see, we have some from Tennessee, Nebraska. It's great to see. Again, just get for folks to see that on this call today, we have folks from across the country. For those who are still perhaps in their morning having their coffee, thanks for joining us, especially for, it looks like we have 3 folks now from Hawaii. Thank you so much for starting your day with us. Okay, I hope this was a good way to get a feel for who might be on the call. And folks can continue to sort of fill this out as we go. But I am gonna move us forward to just talk a minute or two about NACHW. This is a town hall for our ally organizational members, but also our prospective members. Maybe you're just interested in learning a little bit more about NACHW and what we do for our members. So, NACHW is a really young organization. We were founded in 2019 after many years of CHWs and allies together wanting to create the first centralized unifying organizations to see community health workers united nationally to support communities in achieving health equity and social justice. And we do this in a variety of ways. We have started to use this language to describe the different activities that we do to move forward the profession and support community health workers. And that has to do with things like amplifying community health workers, the unique qualities, identities, competencies, and expertise, articulate the importance of community health workers in the past, present, and future impact that communities have on social justice. And it's very important that we do ally with organizations and individuals who share our values and support our strategic priorities, that we want to advance innovation in CHW research, workforce development, integration, and career pathways. That's a lot of the great work that our Workforce Development Committee is interested in doing. And we want to advocate for sustainable and equitable policies and funding for CHWs. And lastly, part of what we're doing today is activating, coming together, and really centering around CHW leadership, capacity, and vision. And now I'm going to hand it over to my colleague Tasha to introduce herself and talk a little bit about our membership and our different types of members.
Hi, everybody. Welcome to this webinar. We are so glad to have you, and kudos and shout out to the Workforce Development Committee for working so hard on this webinar. My name is Tasha Whitaker. I'm based in Dallas, Texas. I'm a CHW and I'm a CHW Network Manager. And so a little bit about our membership. We are in 50 states and growing with our membership. As you can see on the screen, Texas has the most members, and we are really working hard to increase our members in each state. And so this year, for 2024, you will see a lot more engagement, a lot more innovation as we grow across the states and try to get ally organizations involved in our membership, as well as growing our membership. And so what that looks like is including our promotoras, our community health representatives, our CHWs, and getting them engaged also as ambassadors and really elevating and amplifying the work of CHWs. Next. So here's our definition for NACHW organizational membership types. We have 2 types of memberships for our organizations, and they are the CHW Network organizational members, which NACHW defines as organizations led by or co-led by CHWs.
Gracias, ya.
Somebody, look, they must have not been on mute. But that's defined by NACHW as organizations led by or co-led by CHWs, promotora, CHRs, and other titles within our profession. And the mission is to focus on CHW membership, networking policy, advocacy, and workforce development. Our second organizational membership is our ally organizational members. And those organizations are the organizations that really want to support and amplify the CHW work. And so that may look like employers, researchers, public health departments, and others. Membership benefits. You have an opportunity to join our board committees, which we have 5. You have an opportunity to get your information in our newsletters. We have two different types of newsletters, our general newsletter and also our member-based newsletter. And that's another area in which we have become more innovative in sharing about our members and our organizations and the work that they have going on. We also have certificates of attendance for our webinars, which we know that's very important to our CHWs that have to have those CEUs, discounts for the Unity Conference, and some new ones that we have starting this month are being able to submit events and stories to our newsletters, as well as apply for the second annual Hill visit that's happening next month in March. And so if you want to learn more about that, you can check out our website. These are just some of the organizational membership benefits. You can get letters of support. NACHW is happy to support our network members in the work that they are doing to help amplify and move their work forward, whether that's in policy, workforce development. We can provide you with a letter of support. You also get 10 additional logins to your membership benefits, as well as the biannual town hall events, such as this, which is our Allied Organizational Members webinar. And so we really want to know what are some other benefits that you would love to see. So we're going to move to our Mentimeter and ask you guys to submit what benefits would you love to have as an organizational member. And the link is also in the chat, or else you can scan the QR code. So we see certificate training opportunities, scholarships for CHW certificate programs, job placement support, networking opportunities with others in the region, virtual networking, access to primary source databases, the ability to speak with CHW members in one-on-one and group settings for innovative research, career growth. These are great. Thank you guys for submitting these. CHW Spotlight, certificates networking. With the CHW Spotlight, that will start this month with our newsletter. So that's to come. That is to come. CHW Ally Manager Training, okay? Connections with other organizations. And hopefully this type of webinar will be a space in which we can continue to do that. That's workforce development is really working towards, and being able to connect allied organizations and learn more about your needs. So a repository for community linkages. Thank you guys so much. This information is very helpful, and we hope that we're able to implement some of these things in the next coming months. And so I'm going to pass it to our workforce development chairs, Ben and Kim.
Good afternoon, everyone. Hello, my name is Kim J. I am a CHW from Chicago, Illinois. And what a pleasure it is to be a part of this amazing town hall with all of this great energy on the call, because we do really want to tap in and see how we can more effectively support our allies and be a resource for you all. Next slide, please. I want to tell you a little bit about our committees. As Aurora told you guys before, we're a fairly new organization, but we are committed to pushing forward and lifting up and highlighting the value and the importance of community health workers. And when you do that, you have to have a good infrastructure. So within NACHW, we have various committees that are committed to making sure that policy is appropriate. That with the development committee, that we have our eye on the right pathways for things to do to be an efficient and effective organization. The executive committee, the nominations committee, and with us, the workforce development committee, we want to make sure, again, that we include the voices of CHWs and the CHW's workforce and allies and stakeholders to definitely have conversations to speak to what best works for us all, because we know that everything that we do is not a one size fit all. So although there may be some input from other places, that may be collective, we still need to understand what is the best way to support CHWs and our allies alike, and even speak to the sustainability concept. So, if you are interested in any of the committees as you become more connected with NACHW, please feel free to check it out and dig a little deeper. I want to give a snapshot of the Workforce Committee team members. And it's always great to put a face with a name. So this next slide should be very helpful in showing you those who are a part of the board and that workforce development. You have myself, Kim J, as a co-chair, and my colleague Ben Hummel, who is the chair, who's going to introduce himself shortly. We have our colleagues on from various areas in Massachusetts, California, and for our committee members in Hawaii, Indiana, Virginia, Alabama, Rhode Island, and Illinois. We are trying to do our very best to have a diverse voice at the table. So again, as a Workforce Development Committee, we are an effective representation of voices around the nation so we can deliver some of the requests that are out there for our allies and our CHWs. So I'm going to dedicate this next slide to the chair. Ben, the floor is yours.
Thank you. Yeah, and just a quick correction on that front. I'm a co-chair. Kim and I are co-chairs. We had a kind of small little typo there on that end. Couldn't do this work without her. But yes, welcome everybody. It's a pleasure to be with you today. I'm Ben Hummel. I'm a CHW ally and a board member at NACHW, and I'm joining today from the state of Maine, where I work at Maine's health department. And it is also very exciting, as Kim had pointed out, to have 7 members of the Workforce Committee join us today, and you'll get an opportunity to meet them in the course of the breakout rooms later in the call. As part of this slide, I wanted to provide participants with a brief overview of some of the past NACHW efforts that the Workforce Development Committee has contributed to. So kind of getting us started here in May of 2022, the Workforce Committee had assisted with developing a letter that was sent to the Health Services and Resources Administration regarding a funding opportunity for CHW training programs. There were concerns raised at the time around the grant's potential impact on the CHW profession. So we have included a link within the slide here so you can read more about that in terms of NACHW's advocacy work for the workforce and the potential impacts of federal funding and how they're structured on the workforce. In August of that same year, the Workforce Committee partnered with NACHW's Development Committee to deliver a session at the 2022 Virtual Unity Conference that was focused on strategies for promoting CHW career advancement. And then at the end of 2022, for the first time, the Workforce Committee recruited NACHW members who were not serving on the board to join the committee. And we had 8 members that were onboarded in early 2023, and many of them are joining us here today for this webinar, as we've already mentioned. Last June, the Workforce Committee hosted a webinar that was focused on engaging members around the successes and challenges of building CHW training and apprenticeship models across the country and exploring areas for support around that topic. And then at the 2023 Unity Conference, the Workforce Committee and Development Committees partnered once again to deliver a session that was focused on models for building, expanding, and sustaining CHW networks in different states around the country. And then finally, this past fall, the Workforce Committee assisted with preparing NACHW's letter to the Center for Medicare and Medicaid Services that was in response to their request for information about CHW roles within the physician fee schedule that was being proposed for 2024. And we've also included a link in the slide so you can read more about the content that was covered within that letter. So in short, the Workforce Committee has been busy over the last several years, but we are looking forward towards future initiatives where we can focus our efforts. And with that, we can transition to the next slide, and I will hand it over to Yanel, who's going to lead us through another Mentimeter activity.
Thank you, Ben. Good afternoon, everyone. My name is Yanel Powell. I am a community health worker from the state of Delaware, and I'm also a newly elected board member for NACHW. So our next question is going to be, what does it mean to you to be a CHW ally?
And just
to
pointing, or go ahead, Yanel. Yeah.
I was going to say, to participate, just join us, the mentor meeting. The link's in the chat. And we're getting some answers in now. Some are saying advocate, partner, amplify importance of the work of CHWs, support CHWs. Some are saying finding ways to better support the patients and individuals that both CHWs and case managers serve, to have a resource, another avenue to assist the community. And also, it means that you are part of an organization. We also have promoting and advancing CHW workforce, support CHW workforce development and promote CHW work in healthcare systems, and advocating and supporting the growth and advancement of CHW, making a difference in someone's life, which is always important. CHW champion in the integration of CHWs in all settings, share access to resources, information, and best practices, help raise CHW voices, adding a level of support resource in our community, be aware of CHWs and its resources to support the efforts and point the clients in the right direction. And then we want to support and advance the work of CHWs because they play such an important role in public health. So thank you all, great suggestions, answers. All right.
Hi, everybody. My name is David. I'm one of the board members here for the workforce development. I'm CHW coming from Hawaii. Pardon the noise if you hear noise in the background. I'm a little in the community right now, sort of doing outreach, so I'm multitasking. So this next question we wanted to ask participants is, in what ways can NACHW support your organization around CHW workforce development? So some of the responses we have here: recommendations for professional development. That's a good one. Help organize regional networking. Okay. Any more? There we go. Trainings, seminars, networking. There we go. Increase content on how CHWs can work with other healthcare professionals, financial stability strategies. Many of our local organizations want to expand their CHW teams or having trouble sustaining the employment funding for their current teams, providing important connection points and engagement opportunities to get ideas and funding to the right place at the right time, direct employers, the resources, introduce CHWs into the workforces, training resources and policies, workforce development, best practices, support toolkits for advancing CHW workforce, more training funding for employment, collaboration, training resources, training funding, best practices for team integration, and then statewide and national training structure. Awesome. Call to action when instructors, mentors, and curriculum assistance is needed. Help and support or drive policy that benefits the profession. then training, CHWs. A lot of responses around training, development. Funding. All great feedback. Thank you so much. Next slide. So this next question, what we want to ask people are, what topics related to workforce development are of interest to your organization? So here we want to think about HW career advancement and retention, integration into healthcare teams, clinical and community partnerships involving CHWs, community engagement strategies that involve CHWs, CHW recruitment and hiring, onboarding and training for CHWs, CHW specific supervision programs, evaluations, financing and sustaining CHW programs, which is mentioned in the mentee. So go ahead and put all your ideas in the chat if you haven't already done so.
Yeah, and just to clarify, I think on this one, there might have been a small glitch where we don't actually have a mentee question where people can check off, but I welcome folks to put additional thoughts that they have around this in the chat, and I appreciate those who have already taken the time to list those that are resonating with them.
And we have one response is ensuring that employers are hiring people that are actually identified as CHWs, community engagement strategies involving CHWs. Financing and sustaining CHW programs. Yeah.
Thank you, David. I was on mute.
I'm practicing my Vanna White skills.
You got it. You got it. CHW integration in healthcare teams and other sectors. Great feedback so far. Financing and sustaining CHW programs, which is very important. Opportunities for CHWs to gain practicum hours around the country remotely.
Oh, I really love that last one.
Thank you, David.
Okay, next slide.
Okay, so we're all going to really get a chance to vocalize some of these things in great detail in breakout sessions. So we're going to discuss a few questions regarding best practices, innovations, the type of information that you are seeking from, workforce development. What could we possibly do that could assist you in moving your programs forward or better supporting your community health workers? And then what is the one question you'd like to pose to other CHW allies? So with these questions, we are going to break out into regions to have this discussion. And you are color coded. So just in case you're not sure, in the West, Janelle, are you? Okay. So in the West, that's green. The Midwest, it's going to be me in the yellow. Dr. Francis is in the South, which is the red group. And then the Northeast is blue, and that's Janelle and Joanne. So we are going to have these deep dive conversations, and we've already been set out to go into our specific groups. So I am asking this question, this clarifying for our facilitators. Would you like for each of us to display the questions in the breakout room, or will you display the questions in the breakout room?
For room 3, we'll display the questions in our room.
Same with
Yeah,
the,
same.
Then that will be the consensus. We would display our questions in the breakout room, and we will have a conversation to discuss further how we can to take that deeper dive with those questions and how we can be better support to our allies around the state, around the country. So when we are ready for our breakout rooms, you get the prompt, join your room.
Okay, I just opened our breakout rooms. Many of you are pre-assigned if you included your state when you registered. If not, no worries at all. Tasha and I are here to help get you where you need to go. If you do have sort of the latest version of Zoom, hopefully some icon around breakout rooms appeared at the bottom of your screen. And there you can go and choose which room you would like to join, again, based on region. But if you're having any trouble at all, feel free to put in the chat where you'd like to go, and Tasha or I can plop you in there, or you can come off mute and we can help you there as well.
It looks like, okay. Julie Sterling is left.
I'm going to pause recording while we're in breakout rooms, and I'll start it back up when we're back.
Well, welcome back, everybody. I hope that you found the breakout discussions to be informative and that you were having rich conversations with one another about some of the discussion questions. We're now going to do kind of a quick roundtable to the workforce committee members that were in each of the breakouts to provide a short synopsis or overview of some of the themes, ideas, and questions that were emerging during the course of your discussions. So we will bring up the share screen of some of the notes that were entered into the slide deck. And I'll kind of go one by one and call on some of the different workforce committee members to start with their reporting back. So I think first we have Lily Lee in the West region. So do you want to get us started here, Lily?
sure. Am I sharing the screen?
I think we can see it at this point.
Oh, you can. Fantastic. So our group, we ran out of time. I think, we were just beginning to discuss more about what the different states represented in our group are doing. We definitely talked about, for example, in California, there's been a growing proliferation of certificate programs because of the state guidelines that had come out recently and has been put on pause, if you have been following California. Another CHW who's actually working on CHW curriculum talked about just really her different approaches in developing curriculum to establish and bridging more relationships with other professionals, integrating with CHW workforce to improve their clients' treatment outcome. And in Hawaii, there's discussions and work around how to approach the cultural considerations in delivering services to different populations. Around the best practices, some hopes and desires is to really talk about looking at how the CHW outreach is changing to involve telehealth, telephonic, or video, engagement with their clients. So what does that look like in practice, and safety and cultural considerations that needs to be learned from these experiences, and also looking at the impact of the Medicaid and Medicare reimbursement on, and the variations that we're seeing from state to state, even on the reimbursement rate that is not quite aligning to even the cost of living differences in those states. And I think we kind of lost track of time and lost a little bit of the discussion, but was able to capture the importance of, considering documentation and building some consistent documentation that will be linked to billing. Thank you all.
Awesome. Thanks so much, Lee, for the report back. Yeah, it's always a challenge to fit in such big topics to kind of a 15 or 20-minute period, but thank you. It seems like a lot of great ideas and points are being brought up there. Let's transition over to the next group, which I believe it was the Midwest region. And Kim and Margarita, I think I'll turn to you guys, and no worries if you weren't able to get notes into the slide, but we'd love to hear from you just on kind of overall impressions on some of the themes that were emerging as part of your group.
Absolutely. I was displaying the questions so I could do those notes simultaneously. But in a synopsis, because I'm looking at the time ebb away, I want to say some of the best practices that were discussed in our group were speaking to learning collaboratives and how they provide a space of networking and collaboration for not only CHWs, but for supervisors, and how that helps to support in those roles and offer instant feedback and professional development in those spaces. There was also like a space for assessment tools that can be utilized to as best practices for onboarding new community health workers into spaces, so that there are no hiccups or areas of not understanding how to do it, but some one pages that really not really one page, but some tools that provide that guidance, and also being able to just support integration, because there is always a pushback in some areas about CHW integration, but there's a tool that they've created to offer best practices for that. And also some of the needs were like a guide on best practices on how to, for organizations, how to integrate community health workers into spaces as well. As we go down, there's a need for toolkits, because sometimes organizations don't have the capacity to produce toolkits for maybe onboarding, for implementation, and they have those best practices already in place. Would be a great thing for NACHW to be able to supply in greater number, and opportunities to network and offer support for new supervisors that come into their roles. And lastly, just some challenges that have been seen as getting CHWs in advocacy spaces, because sometimes they're not seen as appropriate advocates in those spots, but having us a way to explain the validity of having CHW voices in those advocacy spaces. And I don't want to cut off any other groups from having a talk, so I'm going to stop right there and give others an opportunity to add some feedback.
Yeah, great synopsis, Kim, and thank you so much for trying to keep it succinct as possible. I know it's a challenge with pretty dense conversations that are going on, but let's transition over to the next group, which I believe it was the Southern region, and I believe Stephanie, you were the reporter for that group.
Yeah, so I'm just going to highlight the questions that we came up with. We've got 4 here. What's the first step that you should take in developing a CHW program at your organization? Lots of things going on, lots of great places to start, but where should you start to actually get going? How do we balance empowering CHWs to grow in their careers with others who may not want to grow right now? Looking at, can we work towards greater consensus on what qualified means, as far as, some states have requirement for 20 hours, others have 200 hours that are needed. And so what does that actually look like? Can we get more of a consensus, that more streamlined? And then how can we go about finding partners to offer continuing education credits to CHWs for trainings that we provide?
Yeah, all excellent questions. I think that open up lot of areas for exploration. So thank you. That's great to cover those, Stephanie. And we'll finally move over to the Northeast region. And I believe, Yanel, you were our reporter for that group.
Definitely, say the best for last. Some best practices were to have a practicum program, make sure a practicum program is provided after training, acting as a mentor, apprenticeships for CHWs, teach CHW cohort. No, Louise teaches a CHW cohort in Idaho, right? Louise, I don't know if I got that right. But they have already apprentice training opportunities in that state, and then a pathways track. And then the other one was, what are the challenges? And using smartphones to go through this training. Like the training's lengthy, it's like almost 80, 90 hours. So using smartphones instead of laptop computers, poor Wi-Fi connections. And I want to put my little input in that too as well, the accountability. Like this is a training program to help better you, help you become a CHW and hopefully become certified. So the same way that you would, be in school or online classes, like the same accountability should be the same for that. And then allied organizations working in silos. There is not an active coalition in the state of New York. That is something that would be helpful. And last but not least, what question would you like to pose to other CHW allies? How to find funding for workforce development?
Great. Well, thank you, for closing us out there with the recap for that final group. We just have a few minutes left here, so we will kind of transition into our final slides. One thing we did want to provide to people today was just kind of forward-facing an overview of some of the opportunities and resources that workforce development is looking to be focused on over the course of the next year or so. So there is a guidance document that Workforce is partnering with NACHW on around providing equitable strategies and principles that organizations should consider when doing studies for the CHW profession. We're also doing some work at looking at NACHW's webpage. There's currently a listing of CHW networks and training programs listed, but we'd like to do some work to try to expand that page so there's a more robust listing of resources related to training and workforce development. We are also thinking about how we might develop a set of best practice guidelines for employers around training and professional development, and are even considering what it might look like forming an advisory group with employers across the country to try to develop that type of resource. And then finally, we're also considering the possibility of holding more open calls for members for the Workforce Committee over the course of the next year. So I'll turn it over now to Aurora and Tasha to provide kind of some final updates on how you guys can partner and stay in touch with NACHW around these efforts and some of the other ones that have been highlighted on the call today. So.
Thank you so much, Ben, and thank you all for coming. I know we are rounding down our hour, but again, please stay in touch with us, whether you are a member or you're just part of our network. Please feel free to visit our partnership page if you want NACHW to come speak at your event. If you're interested in meeting one-on-one, maybe you have a question for one of our committee members. Those are all things we are happy to assist you with. If nothing else, please ensure that you are on our free newsletter, which you can find at nachw.org. Follow us on all our different social media platforms, where we will be giving more updates on other events, advocacy opportunities, and new tools that we are developing, some of which will hopefully address some of the questions you had today. And before I completely close us out, I do want to give folks a second opportunity at our earlier poll question. We were able to fix that up while folks are in breakout rooms. So I am going to put the link to Mentimeter one last time. So if folks do want to vote on those different options on what you'd like to see, I think they're all things that we would like to explore as NACHW. But if there are certain areas that you are especially interested in, please let us know. Please feel free to take our post survey, which will pop up as you close the Zoom, and let us know how you'd like today's session. If there are other things you'd like to change, if you'd be willing to stay for 90 minutes for more breakout time, those are all things that are really helpful for us So we really appreciate your time. We know we're 1 minute over, so please stay happy and healthy. And we hope to see you all again very soon. We really thank you all for your time today. Thank you.
Thank you.
Thank you.